Hello learners, welcome to the certificate course in Endometriosis, Uterine Fibroids and Prolapse Nutrition and Health. So myself, Miss Emmy Grace, and I am the faculty for this course. And this is one of the most special topic when you talk about gynecology nutrition. And many women do face these issues, though it is not very much highlighted outside and it is not a topic on high, in which many nutrition professionals would like to study. This is something which is very important when it comes to the reproductive health of women. So this is the course overview of this topic, and let us have a look at what topic modules as well as the subtopics we will be covering in this course. So there are totally 12 different modules in this course, and it talks about endometriosis pathophysiology, pregnancy and endometriosis, IVF procedure and endometriosis, endometriosis and pregnancy risk, diet and nutrition for endometriosis, exercise and endometriosis, uterine fibroids pathophysiology, uterine fibroids in pregnancy, diet and nutrition for uterine fibroids, exercises and uterine fibroids, uterine prolapse pathophysiology, prolapsed uterus and exercises for the same. So now let us have a brief overview of each module and its subtopics. So the first module, endometriosis pathophysiology, talks about what is endometriosis, symptoms, when to see a doctor, the causes, risk factors and complications. Module 2 talks about pregnancy and endometriosis, under which we will see how does endometriosis affect fertility, how to get pregnant with endometriosis, tips to improve chance of conceiving with endometriosis naturally, endometriosis stages or levels and its indication for conception, miscarriage and endometriosis, IVF treatment and endometriosis, FAQs on pregnancy and endometriosis, and we will conclude this module. In module 3, we will specifically talk about IVF procedure and endometriosis, under which we will see the introduction, blocked fallopian tubes, chocolate cysts also known as PCOS, endometriotic deposits in the pelvis, scarring of tissues, inflammation, endometriosis and IVF treatment, and we will conclude this module. Moving into module 4, we will be talking about endometriosis and pregnancy risks, under which the symptoms of endometriosis during pregnancy, possibility of stillbirth, propensity for a miscarriage, risk of antepartum hemorrhage, possibility of preeclampsia, chances of cesarean, chances of ectopic pregnancy, chances of premature birth, treatment of endometriosis in pregnancy, certain tips to manage endometriosis symptoms while pregnant, when to visit a doctor, and we will conclude this module. Module 5 talks about the diet and nutrition for endometriosis. How does food affect endometriosis? The role of fiber, role of fats, minerals that help, foods to avoid with endometriosis, effect of gluten and dairy on endometriosis, and we will also talk about a few supplements. Module 6 talks about exercise and endometriosis, under which we will give an introduction to the module, moving into 6 benefits of exercises during endometriosis, the types of exercises, tips to stay active, and we will conclude this module. Module 7 talks about the uterine fibroids pathophysiology, in which we will talk about what are uterine fibroids, types of uterine fibroids, symptoms, infertility and miscarriage due to uterine fibroids, endometrial ablation, meiosis, myomectomy, hysterectomy, uterine artery embolization and medication, and after which we will conclude this module. Module 8 talks about uterine fibroids during pregnancy. So in this we will introduce the module, and then moving on to the causes of uterine fibroids during pregnancy, signs and symptoms, risk factors, diagnosis of uterine fibroids during pregnancy, complications during pregnancy, complications during delivery, risk to baby, treatment with medication, treatment with surgery, advanced treatments, home remedies to cure fibroids in pregnant women, fibroids after delivery, prevention of uterine fibroids. Moving into module 9, we will talk about diet and nutrition for uterine fibroids, the foods to shrink fibroids, fruits and vegetables, low-fat dairy products, foods that contain vitamin D, foods that causes fibroids, supplements, tips for prevention or treatment of fibroids, and we will conclude the module. Moving into module 10, which talks about the exercises and uterine fibroids, heavy menstrual bleeding with uterine fibroids, exercise recommendations, 4 exercises to try, 2 exercises to avoid, managing pain and other symptoms, and we will conclude this module. Moving into module 11, which talks about the uterine prolapse pathophysiology, in which we will first introduce the module, moving into what is uterine prolapse, stages of uterine prolapse, who gets uterine prolapse, seriousness of uterine prolapse, symptoms, causes, associated conditions, diagnostic tests, management and treatment, non-surgical options, surgical options, prevention of uterine prolapse, prognosis of uterine prolapse, and when to see a doctor. So moving into the last module of the course, which is on prolapsed uterus and exercises. In this, we will give an introduction to the module. We will talk about how to exercise pelvic floor muscles, especially highlighting Kegels, exercises to avoid, physical therapy, and other treatment options we will also be noting down in this module. And finally, we will conclude this module as well as the entire course. So with this, we have come to the end of the course overview on a certificate course in endometriosis, uterine fibroids and prolapse, nutrition and health. So I will meet you all in the course. Thank you.